Orthopedics here at Northwell Health, I think, is very special. What we have built here over the last 15 years is truly remarkable. We have a department and a faculty and a group of physicians that are the best and the brightest in the world. But more importantly, what we're most proud of is the way we take care of patients.
I think the quality that we provide for patients is incredible.
We do not want to settle for anything less than being the best.
Northwell Orthopedics sets itself apart in many important ways. We have incredible technologies and incredible ways to treat many orthopedic issues.
We cover 18 hospitals. We have fellowship-trained orthopedic surgeons in all the subspecialties.
The hospitals are very specialized, which makes the nursing staff more specialized, which makes the care more specialized, which makes the patient outcomes just that much better.
One of the great things about orthopedics at Northwell is how big the group is and how diverse our group is.
Different types of surgeons and different ideas really coming together to create a community that best serves our environment.
Yet at the same time, we are able to be in contact with each other at all times.
When we get all those minds in a room, we all benefit, and it takes us all to the next level.
And we treat our patients like family.
And Northwell has everything, whether it's hand, wrist, elbow surgery, shoulder surgery, knee surgery, tumor, pediatrics.
We're not only a big geography, but we cover all specialties and all subspecialties, and that lets us ensure that every patient, no matter how complex, gets absolutely the very best care.
In the joint replacement program, we have a phenomenal team, and it's a really exciting place to be.
We've spent a lot of time looking at all the new innovative technology that's available to us to give a very personalized approach to our patients, including robotics.
Northwell Orthopedics is one of the forerunners in robotic surgery in the country. We have custom designed joint replacements.
Total Joy Arthroplasty program here at Northwell is a very busy program. We're doing almost 10,000 primary total hips and total knees throughout our healthcare system on an annual basis.
The fact that our patients can move, walk, and do everything the same day of surgery, and even go home sometimes the same day or the next morning after surgery, compared to 3 to 5 day stays of years past, has really changed what we do as a field. Once we finish there, we have phenomenal home care. Then, of course, Northwell has a large physical therapy program.
The surgery we do really helps patients, and I've seen them come to my office not able to walk, not able to do their normal daily activities, and now following surgery, they've got their life back.
Back problems affect almost all of us, and there are incredible, innovative and new ways to treat back issues. And that makes it a fascinating area. Lots of great technology, much better outcomes than we had decades ago. We cover all aspects of spine care, using robotics and navigation, mixed reality platforms, driving the field forward. We have an incredible integration with the pain service, so really new ways to alleviate pain and make recovery from procedures much, much faster. We have sort of like a one-stop shop, physical therapy, the medicine service, neurology. So really an incredibly rich team that works really well together, and that's something truly unique and exceptional that we offer to our patients, above and beyond what our competitors can offer here in New York.
Most large sports medicine programs are built from the top down. Their emphasis is on professional teams, and they build their relationships with professional teams to say, hey, we're good enough for them, we're good enough for you. Ours is reversed. We're completely the other way around. Nuts and bolts of our sports medicine program is built in the community at an early age. So we pride ourselves on being the doctors that are taking care of, the soccer player when he's 8 years old and breaks his wrist. When we see our patients, we treat them like a pro athlete. They come into our sports clinic, they get their MRI within 24 hours, they're into physical therapy right away. Why currently sports medicine is so exciting is really the technology. We've developed so many surgical specific tools and techniques, devices, that now for most injuries, we're able to return the athlete back to normal and playing at their previous level. And that's really what makes the most exciting part of my job, is getting them back.
One of the most exciting initiatives is the advances that have occurred in orthobiologics. The ability to take care of patients and to have them heal quicker or more successfully or more effectively is a game changer. And orthobiologics includes everything from platelet-rich plasma or the use of various types of progenitor cells that we can take and harvest from a patient and then inject back into an area of injury or to an area we have operated on.
I love being a hand surgeon, kind of having so many people within the system that are specifically hand surgeons dedicated to the study and the surgery of hand makes a huge difference.
We have about 20 hand fellowship trained orthopedic surgeons within Northwell. We have MRIs, we have nerve testing, we have CAT scans, all available to us locally. There's no reason to go anywhere else.
Hand therapy is such an important part of a hand surgery recovery. The coordination between our hand therapists and our physicians is amazing. We have such a good working relationship with our plastic surgery colleagues, and to have everyone within the system, just a text message or a quick call away, really just helps coordinate care. That type of real-time communication is so unique.
I want people to get better. I want people to get back doing what they were doing before they had an injury or a problem with their hand. And that's what I tell patients all the time, that my job is to get you back doing the things that you were doing before, whether you're an artist, whether you're a lawyer, an athlete. I want to get you back doing what you love.
Orthopedic oncology is a very specialized branch of orthopedics. So we deal with tumors, cancers, growths in the arms and legs, and they need to be taken care of, often surgically, but sometimes non-surgically. We work with people all over the health system. So we will work with our musculoskeletal radiologists and pathologists to work on imaging and diagnosis, and then work with the radiation oncologists, the physical therapists, the medical oncologists to really create a full spectrum care for our patients. The way that we do the surgery is using 3D printing and patient-specific technology is really exciting. Having some of the molecular looks at the individual tumor, meaning we're not just treating a type of cancer in a patient, we're treating that patient's specific cancer. When a patient comes to us, our first thing is to really make them understand whatever they have is treatable. Handling a patient with an orthopedic oncologic problem, you take them from their diagnosis when they're scared as can be about what's going on, and then helping them through that whole process until hopefully you have a cure as well as their full functioning.
Orthopedic trauma is really a privilege to practice because we take people in their most dire moment of need and get them back to their lives. We're fortunate to have several level 1 and level 2 trauma centers within our health system, both adult and the pediatric. And this allows us to provide the highest level of trauma care and coordination with our colleagues in other disciplines to make certain that our severely injured patients get the best care possible and get back to their lives. In having an active, competitive, academic trauma system where we don't deny care to anyone based on ability to pay or socioeconomic background is really a privilege.
Northwell Health, at the scale that it is, and a very dynamic system, ensures that we're always at the forefront of what we can offer to our patients.
We're doing research at the cutting edge of technology, both basic science and clinical research.
It includes clinical trials where we're co-developing novel technologies both with industry and with other physician scientists.
Northwell just offers such a breadth of care.
That ability to know that there is an expert in any field of medicine here at Northwell is huge.
And how we take care of patients is that we do so in your community, we do so locally from Manhattan and Westchester or Staten Island all the way out to the Hamptons.
At Northwell, you can get the kind of care that is really world-class, but have it local for you.
We're kind of in the trenches, we're in the communities, we're integrated with the people we're helping.
I love what I do. To help people that have been unable to be helped elsewhere in the world.
And really change lives. Like, there's really nothing better than that.
What drives me and makes it exciting to get out of bed in the morning is working with great people.
I'm constantly inspired by the ability to be able to take care of patients. I think making a difference in terms of getting them better is what it's all about.